Hello and well. Today, we're diving into a critical concept in emergency medicine, Beck's Triad. If you work in healthcare or are a student, recognizing these three classic signs is crucial because they point to a life threatening condition called cardiac tamponade. Let's get started. Before we can understand Beck's Triad, we need to know about the emergency it identifies cardiac tamponade. The heart is surrounded by a tough, fibrous sac called the pericardium. Cardiac tamponade occurs when fluid, whether it's blood, pus, or something else, builds up in this sac. This fluid puts immense pressure on the outside of the heart, squeezing it and preventing it from filling with blood properly. And as we know, if the heart can't fill, it can't pump effectively. Beck's Triad is the classic set of physical exam findings that alerts us to this dangerous situation. So, what are the three signs that make up this triad? They are first, hypotension, which means low blood pressure. Second, jugular venous distension, or JVD, which is the bulging of the neck veins. And third, muffled or distant heart sounds. Let's break down each of these signs one by one to understand why they happen. First up is hypotension. Why does the blood pressure drop so significantly? It's a direct result of the heart being squeezed. Because the ventricles can't fully expand, they can't fill with enough blood. This is called decreased ventricular filling. Less blood in means less blood out with each beat, which we call a decreased stroke volume. This leads to a drop in the overall cardiac output, and the result is a sharp, dangerous fall in the patient's blood pressure. The second sign is jugular venous distension. So, why do the neck veins bulge? Think of it like a traffic jam. The heart, particularly the right side, is being compressed and can't accept the normal flow of deoxygenated blood returning from the body. This causes blood to back up in the venous system, starting with the superior vena cava. This backup increases pressure in the jugular veins, causing them to bulge visibly in the neck. It's a key sign that there's a serious obstruction preventing blood from entering the heart. The third and final sign is muffled heart sounds. This one is very intuitive. That layer of fluid accumulating in the pericardial sac acts as a sound barrier. When you place a stethoscope on the chest, you're trying to listen to the crisp lub-dub of the heart valves closing. But with tamponade, the fluid dampens those sounds, making them faint, quiet, or as if you're listening to them from underwater. It's a direct physical sign of the fluid that is causing the problem. It's also important to know what can cause cardiac tamponade in the first place. The most common cause is trauma, especially a penetrating injury to the chest, like a stab wound that nicks the heart. Other causes include pericarditis, which is inflammation of the sac, complications from cardiac surgery, cancer in the chest, or a tear in the aorta, known as an aortic dissection, that leaks blood into the space. If you recognize Beck's Triad, you must act immediately. This is a true medical emergency. First, call for help, whether that's a rapid response team or a code blue. The definitive treatment is a procedure called pericardiocentesis, where a doctor inserts a needle into the pericardial sac to drain the fluid and relieve the pressure. Your job is to prepare for this by getting the emergency cart and supplies. In the meantime, you may be asked to administer IV fluids to temporarily boost blood pressure, and you should always apply oxygen and keep the patient on continuous cardiac monitoring. So to summarize what we've learned today, Beck's Triad is a set of three clinical signs for diagnosing cardiac tamponade. Those signs are hypotension, jugular venous distension, and muffled heart sounds. When you see these signs together, you must think of cardiac tamponade and act fast. Your rapid assessment and intervention are absolutely critical and can save your patient's life. And that's a wrap on Beck's Triad. Thank you so much for watching. I hope this video helped clarify this important topic. If you have any questions, please drop them in the comments section below. If you found this helpful, don't forget to hit the like button and subscribe for more educational content. And finally, if there are any other subjects you want to learn more about, let me know in the comments. See you in the next video.